There's no way to say thank you. How do you say thank you for receiving a donor's heart?
An epic health journey, all culminating with a new heart beating inside her chest. And what a journey she endured. Cancer, a life-changing surgery, and then a heart transplant. Coming up on today's All Things Heart, the multiple battles this woman survived before receiving the gift of life.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, February 23rd. I'm Alexis Del Cid, and welcome back to All Things Heart. Here's what we're talking about today. When Kathy Schutte was diagnosed with cancer, she didn't anticipate that the treatment that would save her from the cancer would ultimately cost her dearly. We explained the damage it did to her heart and then what she had to do before she got a new heart. Plus, we take you behind the mask. Our doctors are incredible inside and outside of the hospital. We know that. And this one has the need for speed. You're about to meet the doctor who trades in his mask for a helmet every day. It's a good one, and we love answering your questions. Make sure you send them to us on YouTube, Facebook, and at the All Things Heart email. You can find those links right here on your screen. Kathy Schutte was diagnosed with cancer in her 20s, and she beat it. But 2 decades after that, she was diagnosed with heart disease, caused by, doctors say, that life-saving cancer treatment. Doctors also said she needed a heart transplant, but there was a roadblock to that transplant surgery: Kathy's weight. And she's not alone. Patients can be turned away from transplant programs because of their weight. And in Kathy's case, her doctors here at the health system worked with her to find a bariatric surgeon to help her.
There we go.
What a moment in time.
Are you ready?
A life saved.
Can you hear it?
As another life leaves this world.
What you think?
What would you say?
Yeah. So much.
It's something Kathy Schutte's been searching for ways to express since May 24th, 2020.
There's no way to say thank you. How do you say thank you for receiving a donor's heart?
Her journey begins all the way back in 1995 with a Hodgkin's lymphoma diagnosis. Kathy was in her 20s and living in Romania doing mission work helping single moms.
And I'd had a lump come up on my neck.
She remembers doctors warning her the treatments that saved her life could one day cause heart problems, and 20 years later,
I felt like I had asthma, that I was wheezing and I couldn't breathe.
Kathy was diagnosed with heart disease, which is how she met the cardiologist she now credits with saving her life again, Dr. Bhanu Gupta at the University of Kansas Health System.
He was amazing from the very beginning. I just felt very cared for, which shocked me that, do I need this much care?
It didn't register with Kathy how much care she needed until she heard Dr. Gupta utter the words, heart transplant.
But it did. It rocked our world.
To make it more complicated, Kathy, who had battled her weight her entire life, would need to lose a considerable amount to qualify for this life-saving transplant. And it became clear, as she struggled to do that she needed help.
And finally, after a year, Dr. Gupta said, we need to talk seriously about surgery. And I said, I'm ready to listen now.
What followed was a 1.5-year whirlwind. December 2018, Kathy gets gastric sleeve weight loss surgery. January 2020, she and her now husband, Mark, go ahead with their wedding. March 2020, the pandemic hits. May 2020, Kathy and her family get the call.
I am writing this letter to tell you how sorry I am for the loss of your loved one and how grateful I am for your gift of life to me. I wasn't thinking about what I was getting ready to go through. That all I could think about was him. I could not stop thinking about my donor and their family.
It's a long letter Kathy says took her 10 months to write. She took a picture of the letter with her cell phone before sending it so she could always remember what she wrote.
Please know I will always cherish the gift and remember your loved one, Kathy.
She still has the stethoscope, a gift from her surgical team. She listens often, and every day with every breath, she lives that thank you.
We are so pleased to have Kathy joining us today. Kathy, along with her cardiologist, Dr. Bhanu Gupta, thank you for being here.
Thank you.
Kathy, you look amazing. How are you feeling today physically?
I'm feeling great today.
I can tell it. Is it weird to watch a story about yourself?
Oh, yes, it was. It brought tears to my eyes.
Your journey is amazing, and Dr. Gupta, you helped guide her through this entire journey. And I want to go back a little bit because when it comes to the guidelines to qualify for a transplant, weight in particular, are there a set of rules that are set by a board, or is it a case-by-case basis? How do you determine whether or not someone needs to lose weight before they can get a new heart?
That's a great question. Thank you, Kathy, for letting me the part of your amazing journey and the trust you had in the team we have at University of Kansas Health System. So, to answer your question, Alexis, weight is we have very convincing and data about very low weight and very high weight has poor outcomes after heart transplant. So the data has been there from almost 30 years of data registry analysis that patients with BMI above 40 have very poor outcome, and in fact may not benefit from heart transplant because their heart does not do well. And similarly, patients with very low BMI may not do well. So yes, weight is an important part of the evaluation for heart transplant. And at University of Kansas, we are very accommodating. Many centers have BMI cutoff 35. We have extended it to 38 to accommodate more patient population.
And Kathy, you had survived so much already before you reached the point of needing a new heart. You'd survived cancer. Then you're told you need a new heart, but you have to lose weight, and you had struggled with your weight like so many people do. So what went through your mind at first when you learned it was a barrier to getting a new heart?
Well, at first I thought I can do it on my own. I don't need the surgery. I can do it on my own. But as my health was just getting worse, I saw that I was going to need some help to lose that weight, and it was hard to make the decision. But Dr. Gupta just encouraged me, and I trusted him that was going to be the best thing for me at that time.
And in the middle of all this, you fall in love and meet a great guy, and he asks you to marry him. At what point of your journey did he propose to you?
He proposed, it was about 6 months, no. Yeah, it was about 6 months before transplant. It was the month before I got put on the transplant list that he proposed.
And you had just underwent bariatric surgery?
Yes.
As well, and he was like,
yes.
I'm not waiting till any of this passes, let's just get married now.
It's exactly, because I gave him, I said, we can wait till after I have transplant. He insisted, no, let's do it now before. So 2 months later, we were married.
I love that. I love that. I want to bring in Dr. Gupta because you sent us some images and some imaging of Kathy's heart, and I would love it if you would walk us through these. We have x-rays and echo images. So let's start with the x-ray here. Now, for people without the medical eye, I can't tell what I'm looking at here except an x-ray. What do you see here that was alarming to you?
So Kathy, it has enlarged heart, and both chambers of the heart are enlarged, which is both the right side of the heart and the left side of the heart. This X-ray is reflective of those dilation of the chambers of the heart, which we can see the shadows of the heart right in the middle. There is a large shadow on to the right side of the heart and the left side of the heart. Yes, enlarged heart is a bad prognosis.
And then let's pull up the second image, because we have another image of her original heart. What is this? What kind of image is this, and what are we seeing here?
Sure. This is a still images of echocardiogram of Kathy's heart, and that's also reflective of both the left side of the heart and the right side of the heart are enlarged. And if we had live pictures, we would see that her heart functions were substantially, or we call it severely reduced ejection fraction. The amount of the blood the heart pushes in each beat was substantially low.
And we also have an image of her new heart. So that's the healthy new heart.
That is correct. As you can see, the chamber on the right side of the heart is smaller than the previous one. So certainly this new and healthy heart is appearing very healthy, although it's very difficult to say that on the still images. But
the other one looked puffy and fuzzy.
That is correct.
To me. We have a QR code up on the screen, and we're going to have this up the entire program. It will take you to our heart transplant page. You can learn more about heart transplants and the entire process. So we're going to keep that QR code up as we continue this discussion. Kathy, what was your initial recovery like from the weight loss surgery? Was that tough, or was that easygoing?
That was pretty easygoing at the beginning. And then I started having some issues, and actually had to have a revision later on. But yes, it's been pretty easygoing.
Which was tougher, recovering from the weight loss surgery or the heart transplant? They both sound grueling.
Definitely the heart transplant.
Tell us about that. What was that like? You wake up, and what did you think the minute you came to and opened your eyes?
The first time I woke up, I remember I had I was intubated, and my arms were attached to the bed, so I would not pull that out, I'm assuming. And I woke up, and they told me they were going to be taking out the tube. So they took out the tube, and I did not feel well. I was having a hard time breathing. And I realized that there was something wrong, and the doctors and the nurses at that point also realized that there was something wrong. I may not have my days. I know I was asleep for a couple days afterwards. But I ended up taken in for another surgery.
And this is a picture we're showing of you. You're holding, it looked like a ball, and you're practicing standing up and sitting down. And is that part of your physical therapy post-transplant?
Yes, that was week 6 after transplant.
So week 6 is still practicing being able to sit down and stand up on your own and just get your strength back.
Absolutely, yes. I was in rehab for a week.
Now I want to ask Dr. Gupta about the weight loss component. When a patient has to lose weight before their heart transplant surgery, can they stay on the heart transplant list, or do they get kicked off the list and then brought back on once their BMI is down?
So we do not, based on the data, we do not list patients if they do not meet the criteria for the BMI. So if anybody BMI of 38, we give them enough chance to work on weight loss strategies. We've got many strategies available to get the weight loss at the target goal. But once they meet the criteria of BMI of 38 or below, they are listed directly. Yes, if they regain weight enough above 38, we have to start having serious conversation with patients of not gaining further weight, and we have to come up with more strategies to stay within the goal of 38 and below.
You've also talked about, which is, I've not heard this one before, you have had patients who've had to gain weight before they get a heart transplant. Is that rare?
There are a certain group of patients who are extremely on the low BMI category, which is lower than 22, but they are rarely encountered in our practice. But yes, if your BMI less than 22, we encourage patients to stay within the range of 22 and above BMI category.
I have a question for Kathy. You and I had touched on this a little bit when we met a few months ago. You had said that you did notice changes in certain foods you craved after receiving your new heart. I love asking people this because you always hear stories that they might start craving a food and they wonder, did my donor like that food? So what did you start craving that you never liked before?
I actually started craving beets.
And beets is very specific.
Something I did not like before. But
beets is a controversial vegetable. You either love them or you hate them. So you never liked beets, you disliked beets. And do you know anything? Do you know anything about your donor's family or your donor, if he liked beets, or have you ever heard back from them?
No, I have not heard back from them. I have written them, but I have not heard back from them.
And the letter that you shared with us is stunning. I want to go to some questions from the community because we're already getting some questions from our viewers. Marie wrote in. She had a question for Kathy, and she wants to know if you're going to write again, since you haven't heard back from the donor family yet, or how do you reconcile that? We know how badly you want to thank them.
Yes, I definitely plan to write again. And I will probably continue doing so throughout the years, even if I don't hear back from them.
Just to update them. Sherry has a question for Dr. Gupta. Sherry wants to know how you calculate BMI and if it's still the standard measure of health.
Yes, BMI is calculated weight in kilogram divided by the height in meter square. So that's how we get this number. Now, it is the BMI is not a perfect measure of your health or weight. There are other factors which we take into consideration, such as your waist measurement. We call it central adiposity, which also is a risk factors for cardiovascular diseases. We have other measures such as fatty liver. We have the measurements such as with bod pod, we measure the central adipose tissue. So yes, BMI is a marker, but not the absolute marker for assessing your health. Level of fitness is another important marker for cardiovascular health.
Got a question that Guy Huntley just emailed us. He writes, love the show. Thank you, Guy. I have a question. I am a long distance runner, run about 50 miles a week. I hear the news about athletes having heart issues. Is this something usually related to underlying conditions when an athlete has a heart issue?
Yeah, that's a question, very important question. Yes, there is some data that athletics who are extreme athletics or involved in extreme training and competitive sports after certain ages are a little bit or at higher risk of cardiovascular complications such as atrial fibrillation. So having before committing to those kind of competitive sports, I think good cardiac evaluation is recommended to make sure that those illnesses are identified earlier before you commit to those extreme sports activities.
Leslie has a question for Kathy. Leslie wants to know if you had to make any dietary changes after your heart transplant.
Yes. I feel like it has definitely helped me to make lots of positive changes and trying to get out there and walk and trying to move. But yes, definitely.
And Joan, to piggyback on that question, Joan wants to know about dietary changes after the weight loss surgery. You know, Kathy, one thing that Alex and I noticed, a photographer Alex and I noticed when we were with you, is that you are so healthy, you grill everything even when it's blizzarding out. You use your little grill. You and your husband don't ever fry anything.
No.
Was that always the case, or was that the big lifestyle change? Yeah.
No, that is something that we have changed. Grilling out and just trying to prepare things more healthy and trying to eat at home and not eat out as much as we used to.
Tim has a question for Dr. Gupta. Tim wants to know, what are the odds a body would reject a new heart?
Yes, a very important question. Thank you for asking that, Tim. There is the highest risk of rejection in first 6 months, and definitely first 3 months right after the transplant, and then first 6 months it starts slowing down. So on an average, about 20% risk of rejection, heart rejection, but also there is a fine balance of risk of infection. If we suppress too much immunity, the risk of infection can accelerate, and that is another challenge we have to deal with. So having a fine balance of immunosuppression and prevention of infection that we aim for, yes, definitely. And after a year, the rejection rate continues to go down, but there are other problems such as 5 or 10 years down the line. There's a risk of, we call it CAV, or cardiac allograft vasculopathy, and risk of cancer after 5 to 10 years starts going up.
Tim has a question, and this would go for Kathy and for Dr. Gupta. Tim writes, I can't help but notice you went through a lot of this in the middle of a pandemic. What struggles did that present to you, Kathy? And then I'm going to ask Dr. Gupta the same thing as her doctor. But Kathy, how do you go through a pandemic and all these health crises?
That was definitely a struggle, and the hardest thing was not being able to have anyone come and see me in the hospital. That definitely was the hardest thing. I went for almost a week and a half without seeing my husband or my parents. I hadn't seen them for probably about 3 weeks. But then things had changed in the hospital. I was able to have one visitor a day after 3 weeks.
We have some images of them holding up signs. There's a big crowd out there of people holding up signs for you. Who's all in that crowd?
Just a lot of friends. A lot of friends that came to encourage me, and it was a surprise.
That's amazing. That must have been so uplifting. Dr. Gupta, did it present unique challenges to you as a doctor to treat Kathy with so many things going on during a pandemic?
So I think my view on this, that we have followed CDC guidelines, and University of Kansas Health System has been amazingly unique to many of the changes happening and adapt them very quickly. So I think I just followed the CDC and the University of Kansas guidelines to take care of patients, and I did not face many challenges. We continue to provide the best care possible to patients. Yes, there were some restrictions of family meeting the patients, but from a healthcare standpoint, I did not think there were many challenges we faced caring for the patients, especially for heart transplant patients. We continued to accelerate our heart transplant process, and in fact did significant number of heart transplants during pandemic and consistent with CDC guidelines.
We are getting a lot of questions about the weight loss surgery component. Pat wants to know, Dr. Gupta, if you think more doctors will recommend bariatric surgery for patients, heart transplant patients who need to lose the weight. Is that becoming more common?
It should. Patients who are in need for heart transplant and who are suffering from heart failure with very poor quality of life, it is very difficult to lose weight on their own, although it is encouraged to continue those efforts and lifestyle changes. But we know from the fact that it's a very difficult situation. They are not able to do that level of exercise. Their overall chemical environment in their body changes substantially. Therefore, we try medications and the bariatric surgery in order to get them to heart transplant before they get too sick and not be eligible for heart transplant procedure.
Jerry has a question for Kathy. Jerry wants to know if you're back to traveling and doing everything that you did before you were sick, because you are such a go-getter and you love all these adventures. So what's next on the docket? Are you back?
Yes, I'm definitely back traveling. I actually this summer went back to Romania for a visit. So it was so great to just get back into my old life of traveling on the planes and doing everything I used to do.
Is traveling easier now that you're so much healthier?
Oh yes, definitely easier.
And taking an international flight, that's a big leap. That's so exciting.
Mm-hmm. Mm-hmm.
I want to bring Dr. Gupta and Kathy back on, because one thing that I love is that when I bring up either of your names, you guys light up. When I ask Kathy about Dr. Gupta, she lights up, her husband lights up, and the same goes for Dr. Gupta when I talk about Kathy to you. So I want to ask Kathy, you had so many wonderful things to say about Dr. Gupta, who I'm pretty sure I'm making blush right now, about how attentive he was. Can you talk more about what it was about the care you got that impressed so much on your heart?
He just made me feel so comfortable. And he would sit there if I needed something explained. He had absolutely no problem sitting there longer with me and explaining it to me or to my family or to my husband. And I so much appreciated that about him. He just made me feel like I was part of his family. I'm part of this family at KU Med. And that was just amazing, that just the comfortable that I felt with him to talk to him about anything. And it just met everything to me during this time.
Dr. Gupta, when you met Kathy, she was on the brink.
That is correct. That is correct. I would like to share one important fact, that when we encounter patients like Kathy, who I would say have amazing spirit to fight against all odds, and we knew right away when I met Kathy, I think somewhere in 2016 or 17, early 17, that she's fighting against three odds. One is that she has lived 20 years of her timeline from cancer therapy to developing heart failure. But also she developed heart failure, as I recall, 8 or 9 years prior to her presentation to us. And we knew with her weight struggle that she won't be able to lose weight on her own. It's not her fault. It's just that the disease process is so intense that we won't be able to get to that process of weight loss where she would need transplant. And she was not in right away need for heart transplant, because we knew she can be optimized on medications, and she can have another 2 years of her own heart before she would need. And we wanted to use that window to get her to a target weight where she could be eligible for transplants as the need arises. And I think that worked out very well. We got the bariatric surgery done somewhere in, I recall, 2018 or 19. Kathy, correct me on that.
19. Mm-hmm.
Yes, 2019. And I think as her heart failure progressed within 6 to 9 months, and it started progressing 8 or 9 months before her bariatric surgery. So she made a great commitment and the timeline was perfect to get the bariatric surgery.
And then to have that donor who, as you so eloquently put it in your thank you to the donor is they're saying goodbye and giving you, you're breathing your new life as another life is leaving. And that's so powerful. And that you thank them every day. That's very powerful.
Mm-hmm.
We want to bring one more segment that we love. And Kathy, I don't know if you know this, but we learned some tidbits about Dr. Gupta. It's for our next segment called
Behind the Mask.
Behind the Mask. Okay, this is where we get to give a little peek behind the curtain at what our healthcare workers are like on a more personal level. Dr. Gupta shared some great pictures. First, let's start with the cute family pictures. This is an adorable photo. Tell us who we're seeing here, Dr. Gupta.
Yeah, first and foremost, my wife, Shilpa. She has been an amazing partner. She has taught me a lot of things and how to be patient, so I admire her for her help and guidance and friendship. My son, Rohan, he's 6 years old. He's amazing. He's a Minecraft person. He's just learned to know the Minecraft very well, and he teaches me that. And
he looks mischievous too.
Yes, he is.
Yeah.
And my daughter, who's 14 months now, and she's amazing. Has brought a lot of changes in me, I think, personally and spiritually, and things have changed in me since she was born.
Well, one of the things you said is changing brings me to the next picture, which is your need for speed. This was surprising. I got to say, Dr. Gupta, I did not know you rode a motorcycle, and you sent us these fantastic pictures. First of all, you say having a daughter has made you a little more cautious on the motorcycle?
Yeah, I think my risk-taking behavior is no longer, I don't have that risk-taking behavior in me left. So
it looks pretty cool, though. Do you ever ride it with your white coat on?
No, I don't. But yes, I ride with my helmet on. This picture is for just for the pose, and
just
I
posing.
wanted.
And
yes.
we had you go out and made sure your family took pictures of you because we didn't believe it. How long have you been riding?
I started riding a long time ago, since the age of 18, actually.
Really?
Yes, but I grew up in India, but since I came to the United States, I wanted to own a bike, and Harley was a natural selection for me, because this is amazing.
You look like a Harley guy. Does your wife ride?
Yes, she does.
Really?
Yes, well, occasionally, but she does, yes, not very regularly.
And so now that you say parenthood has changed you, what if your kids, when they turn 18, want to ride a Harley? What do you say as dad?
I mean, I would say wear helmet, be careful, and you need to, there are things in life everybody has to go through. Some risk taking.
And you've also grown your hair out since that last picture. You got a ponytail. So seriously, there's a whole other side of Dr. Gupta. You're on a Harley with your hair in the man bun, and you're a life-saving cardiologist. You couldn't script it any better.
I just enjoy taking care of patients, and I think it just gives me enormous pleasure to be part of this journey and taking care of my patients, and I just enjoy doing it. Rest is natural.
Well, thank you so much for being with us. And Kathy, thank you for sharing your journey. It is beautiful to see you doing so well, and it's such an inspiration, so thank you.
Thank you.
We have a great episode coming up next week on All Things Heart.
I had little fuzzies or floaters. I don't know if there's a medical name for it, but everybody gets them.
Yeah, a lot of people get little floaters in your eyes when you blink, right? You don't think anything of it, you blink them away. But for Pat Carney, it was a sign something deadly was brewing. And his eye doctor took one look into Pat's eyes, sent him straight to the ER, which saved his life. We're going to talk about the connection between your eyes and your heart and the danger signs you need to look out for. That's next week on All Things Heart. We'll see you Thursday morning at 10 a.m.